So looking at the anterior pelvic tilt now, and this is another very common postural position that you'll see with a lot of your clients. What is an anterior pelvic tilt? Well, it's simply when the front of the pelvis sits lower than the back of the pelvis. An increase in anterior pelvic tilt will generally cause more lordosis or arching in the lumbar spine. Arguably, and this is quite arguably, an optimal pelvic position is 6 to 7 degrees of anterior pelvic tilt. However, it's when this excessive amount of anterior pelvic tilt starts to cause pain or muscle dysfunction that we should be concerned. So having a look at the muscles that are inhibited and the muscles that are tight, in the anterior pelvic position, we're going to see a large lumbar lordosis. Generally, they're linked together, and that position then will cause the rectus abdominis to be stretched out and weak. The lumbar extensors will be tight and facilitated. The psoas muscle that attaches to the bottom 5 vertebrae of the lumbar spine and up to T12 is generally tight and facilitated in this position, which then inhibits the gluteus maximus on the other side. The same is the case for the quadriceps, which are generally tight, and the hamstrings, which are stretched out and weak. So in terms of range of motion tests to test these theories, have a look at the Thomas test. This will see if there is a shortening of the psoas muscle and the rectus femoris muscle in the quadriceps. Do also the sit and reach test to test hamstring length, because as you start to work on your client's posture, you start to release the muscles that are tight and strengthen the muscles that are weak, then you can start to change that pelvic position. So it'll take it out of that large excessive anterior tilt and start to bring it back into a more optimal position. This can then influence hamstring length because the hamstrings attach to the ischial tuberosities, your two sitting bones on the bottom of your pelvis. So changing that pelvic position backwards slightly will actually release the hamstrings, and you may then see at the next test that they have a little bit more hamstring or have a better result in the sit and reach test. In terms of the strength and activation sequence tests, definitely the one-legged squat to test quad dominance, the trunk flexor strength test to see if rectus abdominis is actually weak. The hip extension pattern test is a very good one. As we said, the gluteus maximus can be inhibited by the deep psoas muscle. So test the sequence of activation of those hip extensors to make sure that the glute max is firing. If not, you'll need to address that in the program. Gluteus medius strength test as well, because of the large anterior pelvic tilt that can change the angle of some of the fibers in gluteus medius. Testing also for hamstring strength, because we saw that the hamstrings can be lengthened and weak, so testing that. And then lastly, testing for gluteus maximus strength as well. Often you'll find that the glute is quite strong. It's more the activation sequence here that's been inhibited by that psoas. And inside your GoX Pro, you'll find a number of exercises for all of those, including releasing the psoas with a trigger point ball, to strengthening the hamstrings, glutes, and abdominals, and the progressions of all those exercises.